Okay, this video is Dr. Dale Bredesen corrected. He's wrote a book about treating Alzheimer's, and he's probably the most famous neurologist in the world in association with Alzheimer's. There's some other ones too, but he's a pretty famous guy. And my neurology doctor friends asked me to study his work. Some of my neuroradiology colleagues were interested in what I thought of his work as well. I've read his book long ago and reread it. I've given lectures on him before. I've gone through numerous of his videos and read his papers, so I've studied him quite a bit. I've given lectures on his work. I've discussed him with numerous of my neuroscience colleagues, and there's some good things about him. I mean, he has a nice little staging systems for Alzheimer's. He talks about the patient can be asymptomatic, and then he talks about how they can have subjective cognitive impairment, whereby they notice something's wrong, but if you give them a test of cognitive function, they'll pass. But they have a subjective notice of a problem with their memory compared to before. Mild cognitive impairment is much further along when they'll fail the cognitive test, but they can still do their ADLs, activities of daily living. And he claims that about 10% of those per year will progress to full dementia. Okay, so now here's where it gets a little more interesting. He does something good again. He says people should be focused on preventing dementia decades in advance. And he says if they do that, they'll probably never ever become demented. I totally agree with all of this, okay? He does mention, he's a trained neurologist and a researcher, and he knows a lot. He talks about rare causes of dementia, things like Lyme disease, syphilis, B12 deficiency, hypothyroid. Yeah, that's all well and good, but that stuff is rare, okay? He talks about the fact that you can't treat dementia with just one pill, which is what they usually try to do, say, oh, this is Alzheimer's, take, Aricept or some other pill, and that seldom is beneficial significantly in the long run. Okay, but now we'll start getting into what this is really about. Oh, I was actually going to have something on the back of my chair, but that's all right. He says that nobody really knows what Alzheimer's is, and that's where it starts to get interesting and funny. Because, for example, beta amyloid, is it causing Alzheimer's? Is it part of the problem, or is it part of the body's attempt to protect itself? Okay, that's not completely clear. And then I actually think Alzheimer's is a little bit of a joke. I'll tell you why. Because there's not an obvious historical finding to diagnose it by. There's not an obvious physical exam finding to diagnose it by. The imaging tests are not that good. I look at thousands of brains for, evaluate memory problems, cognitive impairment, and, this medial temporal lobe, parietal lobe atrophy, you seldom see that in a recognizable definitive pattern, okay? The other imaging tests are not so good. Even at autopsy, they can't really tell that well. Is this Alzheimer's or not? Is this Parkinson? Is this some other dementia? So what I'm saying is if you can't diagnose it, physical exam, history, lab test, imaging test, autopsy, does it even exist? Okay, it's sort of a wastebasket page. Yep, that's Alzheimer's. Oh, is it really? They don't have any treatment that works. Okay, so what I'm saying is it's kind of BS, don't you think? All right, now I'll show you. Here's the best book ever written on Alzheimer's. It's Alzheimer's Turning Point by Jack Delatorre, the PhD. This is the best book ever written specifically on Alzheimer's and dementia. Okay, other ways where I start to part ways with Bredesen. He never talks about Delatorre. I mean, if you're going to talk about dementia, you got to talk about Delatorre if you know what you're talking about. And by the way, Delatorre, he's the guy who tied off the mouse carotid artery. He's not in the standard neurology textbooks, the big 2,000-page one, nor am I. Okay, nor is Christopher Exley, nor is Douglas Kell and Etheresia Pretorius. So the people doing the interesting work, you won't find them in any of the textbooks. That's why I consider the neurology textbooks a bit of a joke. Okay, other things that Bredesen did I wasn't thrilled with was he overcomplicates things. Kind of reminded me of Attia, sort of pretending, well, you need my special knowledge to understand this. And then the other thing, too, when you hear Delatorre talk about Alzheimer's, you know what to do. When you hear Exley talk about it, you know what to do. When you hear me talk about it, you know what to do. I'm telling you what to do. I'm empowering you with the knowledge. Versus, in my experience, somebody who always says, I've got the secret, you must come to me, undergo my testing, my blood tests, my imaging tests, and then my treatment, and by my treatment. He doesn't 100% say that, but he says that more or less between the lines over and over. So what I'm saying is, it's more like a business proposition, it seems to me. He talks about reversing brain shrinkage and rechecking the MRI to look at the size of the hippocampus, the memory center, and the medial temporal lobe, and the overall entire size of the brain. And what I'm trying to say is I used to do research studies like this when I was a fellow. It's really easy to fudge the data, and it's hard to get reliable, precise, accurate measurements when you're talking about small differences, okay? So what I'm saying is he kind of makes the patient depend on him, which doesn't impress me because it's sort of like a business proposition. You got to come to me and buy my stuff. He emphasizes the work a lot of the high-fat crowd, Doctors Perlmutter, Lustig, and Hyman. They're always promoting sort of this high-fat routine, which I think is a big mistake, and I'll explain why in just a moment if it's not obvious already. And then where he totally loses me, I see things exactly the opposite. We know that being fat is a major risk factor for dementia. We know that having hypertension is a major risk factor. Fatty liver is a risk factor. Diabetes is a risk factor. Atherosclerosis is a risk factor. Okay, so that's all obvious, well known. I can tell you almost all the demented patients I see, like 95% of them, 90% of them are both diabetic and hypertensive in my experience. Okay, and another 5% have one or the other at least. And probably the other one isn't in the chart, but they probably have it. Okay, they go together, diabetes and hypertension, and obesity goes in there as well. So what am I saying is, we know that for a fact, all right? Here's the diet he recommends. Pastured eggs, okay? Pastured chicken, beef, wild-caught salmon, bone broth, fish oil, coconut oil, and all these high-fat foods, walnuts and almonds and keto supplements. What I'm saying is, high fat causes insulin resistance, causes obesity, which leads to hypertension. So this, to me, sounds like a diet designed to make a person fat and cause hypertension and cause atherosclerosis, which plugs up the arteries in the brain and causes cognitive impairment. So how could this be the new miracle cure? Now, I'll give him credit. He comes from a research background. He's also done a preliminary research study, proof of concept, where he claims he has the best results ever for treatment of cognitive decline. And now he's working on doing a bigger study, and I'll give him credit for that. That's all good. But you can also, manipulate studies. If you pay a researcher that you want to get good results with something, that researcher has to show you good results, or they'll never get any grant money from you again, ever. And this is also sort of a big business thing. He's selling supplements. He's promoting these different, food plans. He's recommending keto supplements, prebiotic, probiotic things. So there's business money in it. Okay, whenever there's business money in it, not always. Maybe the research is totally good and legitimate. I don't know. Okay, but I'm just saying, what I'm used to, what I sense is this is like a major business plan. All these guys are great money men, okay? I'm not. I've been told, by viewers that I'm a failure because I don't make any money. I don't monetize my channel. I just do this as a hobby. But I sort of smell something bogus here, okay? You must come to me. You must take my test. You must get my imaging test. You must get my treatment, okay? Everything comes through me. No salvation unless you come through me, all right? Whereas my attitude is, like I said, I like deletory. Actually, my versions, they empower you to do what you need to do to help yourself. Okay? And this is like a diet designed to cause, and not only is it bad, it's really bad. Wild-caught salmon, that's going to have mercury in it. That's going to have PCBs in it. It's going to have estrogenic chemicals in it. It's probably fried. That's terrible. It's full of animal protein. Salmon's 50-50 food, 50% protein, 50% fat. A lot of it's sat fat. I would never eat that. Okay, chicken is terrible. He doesn't even say organic. They put arsenic in there to treat the intestinal parasites, and it gets into the chicken. I would not eat that. The chickens are often given estrogenics. They're often given a lot of salt. I wouldn't eat that. In a research study, you feed eggs to the animals, the herbivore animals, to cause atherosclerosis. Now, you're going to feed that to a person to prevent dementia? That sounds like BS, okay? Bone broth, more animal food, fish oil. How do you know you've successfully purified that? I wouldn't go near that stuff. Coconut oil, high-fat stuff. These nuts are high-fat as well. For prebiotics, just eat the plant foods with the fibers, what I would do. Plus, carbon filter the water. He doesn't talk about that. So anyways, I think he's made some good steps in the right direction. He does claim that he's going down the legitimate path of research. I still kind of doubt this is going to be legit. But, maybe it is. Maybe I'm wrong, but I doubt it. I don't see how you could To me, it's like the question, how do you polish a turd, okay? How are you going to make a diet full of eggs, chicken, beef, salmon, bone broth, fish oil, coconut oil, and high-fat nuts a way to open up arteries and get the brain to work better? It sounds like nonsense.